Looks like we've got quite a few people with us already, so I think if everyone's all right, I think we'll make a start. So welcome to today's session, everybody, on leadership and imposter phenomenon. The session today will be hosted by myself and Ross Knoll as AHP Clinical Leadership Fellows within HEIW. And we are delighted to have you with us for the next hour, and the session is going to be interactive, so if you can keep your phones or tablets nearby, that will support with engagement and interacting in the session as much as possible. And throughout the conference we've been keeping the conversations going after sessions on Twitter with the hashtag AHP_Cymru, so please do feel free to tweet about the session and to engage with us after the hour is over as well. And as you will have noticed on our holding slide, we are actually recording the session today to support colleagues who aren't able to join us to follow up at another time that's convenient for them. So if you're not happy to be recorded, please just pop your camera off and then we'll get started. So next slide, please, Lauren. Lovely. So the focus of today's session, firstly, we're going to set the scene and think about why leadership is a hot topic within the AHP world right now. Why does this matter to each and every one of us, wherever we work? Then we'll move on to talking about imposter phenomenon, what it is, what it isn't, why it happens, and strategies to manage this in various aspects of our working lives, wherever we work. Then we're going to hear from our AHP leaders out in practice to hear about their experiences in engaging in leadership in different spaces and their experiences throughout their career journeys. Finally, we're going to wrap up the session with a range of useful resources to support each and every one of you on your leadership journeys, to manage any signs of imposter phenomenon that you've experienced and to put into action the discussions that we've had today. So on to the next slide, Lauren. So just to get us started, we're going to be using Mentimeter to think about how we feel about leadership. Okay, so we just thought at this point it would be really useful to see how people are feeling about leadership, how they feel about their own role within leadership, and just seeing where people are putting themselves on that scale. So what we're saying is on that scale of 0 to 10, so 0 or no being not a leader at any time in any kind of context, and 10 being I feel like I'm a leader all of the time in every situation in which I work. So it looks like we're at about a 6, doesn't it? Okay, interesting, lovely. So we're going to move on to our next slide now. So just to set the scene, so thinking about AHP leadership and why it's so important. Strong leadership is so important to us right now, more than ever, to make sure that we are able to, as AHPs, deliver high quality, compassionate care. And for many years, there's been a lack of AHP representation at higher levels within the healthcare system, social care system, and also within the third sector. But we realised that recently there has been increasing recognition of the fact that we need a professionally diverse workforce, a diverse team, in order to meet the complex needs of the citizens of Wales and also across the UK. And since the introduction of the AHP framework, Looking Forward Together, there's been a growth in national leadership roles for AHPs. So AHP leads for very recent positions such as public health and prevention, rehabilitation, and also dementia. And we know that there's more representation of AHP leaders within other areas as well. So things like Improvement Cymru and Public Health Wales, which supports colleagues to maybe think differently, think creatively, and to work innovatively in different ways. And Wales is trailblazing opportunities for AHPs to lead the way. An example of that would be the fact that Wales is the only nation in the UK to have directors of therapies as full executive board members within each of the health boards. Certainly, we recognise that COVID has been a time for AHPs to really step up to those leadership opportunities. There's been rapid shifts in ways of working, introduction of technology to meet the needs of some of our most vulnerable populations in different ways, We've been upskilling staff in really challenging contexts, offering student placements in different ways. So COVID's really created that space to shine a spotlight on what AHPs can do and how they can bring different skills to the table. And many of us have moved out of our comfort zones. And really, it's this enthusiasm and our motivation to lead that will continue to take us forward as our professions evolve and we meet the needs of the health and well-being of Wales. Next slide. So the importance of leadership in transforming health and social care in Wales is clearly set out for us in a variety of key documents that guide our practice. So we have the AHP framework, Looking Forward Together, which we've just mentioned, and that talks about visible and transformational leadership, that AHP shouldn't wait to drive forward change, that we're well placed to challenge old and established ways of working so that we can develop services for the future that work in innovative ways that mean that we can get the best outcomes for the citizens of Wales. With modernising allied health professions careers in Wales, the post-registration framework, one of the pillars of practice is leadership, and this encompasses teamwork and professional and organisational development. But important to know, this pillar isn't exclusive to a certain group of us, to expert levels, for example, but it underpins activities from levels 5 to 9, from newly qualified practitioners all the way to consultant practitioners. And the framework emphasises that as AHPs, we can develop and demonstrate our leadership at all levels and all parts of our career journeys. Of course, there's a Healthier Wales that talks about, in order to achieve the quadruple aim, we need strong leadership across health and social care, that we can then make a better use of a whole system approach to care to better meet the needs of the population. And finally, within this slide, we have the UK Allied Health Professions Public Health Strategic Framework. And this again has a strong focus on mobilising AHPs to work in increasingly preventative ways so that we focus on wellness at a population-based level. And it talks about how strategic connections between AHPs and others will help to improve public health and reduce health inequalities. Next slide, please. So bringing together this session around leadership today has really created a time for reflection for myself and Ross as we are now halfway through our AHP Clinical Leadership Fellows within fellowship within HEIW. And the year so far has presented many opportunities for us to also step outside of our comfort zones, to reflect on ourselves as leaders and where we feel we are within our own leadership journeys. So aside from working on the development of 2 new strategic frameworks, myself on the AHP Dementia Framework for Wales and Ross on updating the National Rehabilitation Framework and Guidance, the fellowship has provided many opportunities for us to build connections with other leaders across Wales and beyond. Reaching out to partners, setting up steering groups and establishing communication across different organisations has been key to our work so far. And we've also had the opportunity to take part in learning around compassionate leadership at Glyndŵr University. So focusing on those principles of collective leadership and why creating psychological safety within teams is so important. And of course, being compassionate to ourselves as leaders as well, and demonstrating compassion to the people that we work with. We've also had the opportunity to take part in a quality improvement project. So learning about co-production, improvement methodologies, and the importance of collecting robust data to show meaningful outcomes. And these skills will be invaluable in whatever roles we move forward into in the future. And also the fellowship has facilitated us with the opportunity to access masterclasses delivered by a variety of leaders across the system on a variety of topics. So we've had topics such as leadership under pressure, change theory, understanding the financial underpinnings of the health system in Wales, to other areas around overcoming imposter phenomenon, which of course is relevant to today. So as you can see, our fellowship has given us lots of opportunities and chances to learn and develop, but there's also been some challenges too. I'll hand over to Ross here.
Oh, thank you, Laura. Yeah, so as well as the many opportunities, the challenges have included, with dementia and rehabilitation, just a huge scope. So really defining and sticking to the scope of the project has been a challenge. But actually the advice we've been given and chunking up the information has really helped with this. So that's helped a lot. And time management is a big thing, really. So we've been given 12 months, which is great, but we have to really divide our time between the project and all the great leadership learning opportunities that are available to us. And also there's doubt. So thinking, am I the best person to lead this project? Should I be here, or should I be back in my clinical role, back in my comfort zone? So these sort of questions obviously take time, and make you worry about things. And take your attention off your project. And that leads nicely into the topic today, the imposter phenomenon, or syndrome, as you may have heard it as well. So Lauren, I was going to introduce the next Mentimeter at this point and just start to ask people, have you heard of imposter phenomenon? That's great. Well, that's a good start. It looks like everyone in the room, I think, has. I've got to admit, I hadn't heard of it until this year, until this course, so that's great. So we'll ask the next question now, if that's okay. So do you ever think you've ever experienced this? And there's a yes, no, and an unsure, so if you're not sure as well. Okay, yeah, so everybody thinks they've experienced it as well. That's great. So that leads nicely into our talk and into what Laura and I have thoughts about it. So we'll move on to the next slide. So you've all heard of it, but I'll just go through what we kind of picked up in our master classes and chances of teaching. So it was first defined in 1978 by Chance and Immis, and it's when someone attributes their achievements to luck or chance, so they feel like they're going to be found out. Early studies suggest it was more common in your early part of your career. However, more recent studies suggest that actually those in advanced positions often doubt their achievements and whether they should be in the position they are. 70% of people experience it at least once during their lifetime. Commonly, it's during a transition, such as maybe a new job, a new role, or during a period of uncertainty or uncertain times. For an individual, it can lead to reduced self-esteem and potentially some psychological distress. And this can really lead to difficulties in making decisions in work, making you less likely to apply for certain posts or research or service development opportunities. So it really reduces your service contribution as well. As an organisation, it can lead to people in the team staying quiet in meetings, maybe not challenging or changing assumptions, not questioning. This can lead to poor decisions, and evidence suggests, unfortunately, this can lead to a poorer quality of care as well. So we'll just go on to the next slide there, Lauren, please. So you may have all seen this test as well, the imposter test. So that'll be a chance for you to do maybe after the session, but it would be good to know, the degree to which you experience imposter syndrome phenomenon. And then we're going to go into the types now. So we've picked out 5 different types, and then we'll go through the strategies that see how can help you really. So we got the perfectionist. So you may, as I'm talking through them, you may see yourself as one or a mixture of a few. So perfectionists often set themselves really high goals, and if they fail, they tend to have that self-doubt and worry. Often may have difficulty with actually delegation and releasing control of tasks. Then you've got type 2, we've come up is the superwoman, superman. So often convinced they're phonies compared to your work colleagues. So generally work harder to measure up, but this can lead to overload, which can obviously harm relationships with others in the team, as well as your own mental health. And then the genius. So often if they take a long time to master something, they'll feel shame. Tendency again to set that internal bar impossibly high. If they fail at something first time, the alarm bells start to sound. And then you have your soloist. So feel as though you're asking for help will reveal your phoniness. It's okay to be independent, obviously, as you're working in your job, but to avoid assistance when needed is a real risk. And then you have your expert. So these tend to measure their competence by how much and what they know, always seeking out learning opportunities as they believe they'll never know enough. And there's a real fear here of being seen as inexperienced or unknowledgeable. So they're the kind of 5 types we picked out there. And we'll just move on to the next slide, please, Lauren. Just see different ways we've picked up on how we can manage them. So to understand it really is good, and try and disrupt any negative script in your mind. So think about how you would talk to a good friend to change kind of that script in your head, rather than thinking about the negative thoughts you say to yourself. Know what triggers the negative feelings and prepare and rehearse for them. So maybe you are worried about presenting like today in front of a group, you know, or saying the word phenomenon for me was a worry. People questioning your work as well may be an example of this. And preparation's key, really. So if you're prepared and rehearsed, it should help to overcome these fears. Again, another thing I think we're not all very good at sometimes is taking a record of all your achievements, your personal achievements. So again, disrupt that negative script. You know, have in your mind, I have done this well, I've completed projects in the past. So get those negative feelings into more positive feelings. Sometimes we've mentioned perfection already, a perfectionist. Sometimes think good enough. So instead of trying, I'm going to aim for a perfection, especially in the complex health and social system we're in and the tasks we're given, good enough is usually the best kind of aim. And also be curious about your feelings. So if you are feeling incompetent or feeling stupid, you know, feeling that you don't know things, it may be due to something difficult emerging and a conversation that needs to happen. And this is an opportunity to discuss what's going on and how can it be better. So we've kind of use self-doubt as a core skill. It's a really productive reflection of what's going on. And I was going to put this at the top, but talk about things really. Others may have similar feelings, and trusted colleagues can often give you some objective feedback on what your thoughts and worries are. So really get it out into the open, any negative worries you have or any concerns. Often, as we've seen in the group already, you know, people have experienced this, so it's good to talk about it. So we're really excited today to invite 2 people to join us, actually, 2 leaders within I'll pass on to Laura now to introduce them, and we'll start the question and answer session.
Thanks for taking us through that introduction to Impostor Phenomenon and really why it's relevant for us as AHP stepping up to lead, because we know, as you said, that feeling like an imposter can happen when we are out of our comfort zone, when we're doing things a bit differently, or taking the opportunity to lead and trying to bring people along with us. So we're really lucky today to be joined by Lucy Morris, an occupational therapist at Swansea Bay University Health Board, and we also have Sue Wilson as well, who is a consultant therapist, and they're here today to talk to us about their leadership experiences across different settings. So it's great to have them with us. So we're going to be speaking first this morning to Lucy. And then we'll move on to have a discussion with Sue, and then there'll be opportunity for everyone to ask some questions and to chip in afterwards if there are particular things that we want to explore. So we'll get started if Lucy's with us.
Yeah, here I am.
Morning, Lucy.
Morning, Lucy. Good morning.
So do you want to just introduce yourself to the audience and to just explain a little bit about your leadership experience on placement?
Yeah, so my name's Lucy. I'm a newly qualified occupational therapist, and when I was a student for my last placement, I was lucky enough to be chosen to be one of the first occupational therapy or students to be in HIW to take on a leadership placement with Wendy Wilkinson. At the time, I wasn't really given a choice, so it was one of those things that I was put into. But on reflection, I would say it was one of the best placements I'd been on, and I'd learned a lot, and it not only enriched me as a leader, but in my practice out in the hospitals as well. So what I did at HIW was we did a lot of research into service improvement elements, so I looked into therapy-led services. I also did a few student projects which me and my colleagues self-initiated, which led to a change in the curriculum in itself across Cardiff University, across all health professions. And since coming out of that placement, I've been able to take part in a few conferences, and my health board's been really encouraging for me to continue pushing on with it and keeping it in my practice, even as a band 5. Yep.
That's really exciting, Lucy, and brilliant for you to have that opportunity, you know, on a leadership placement before qualifying. That's brilliant. And obviously with Wendy as your mentor. I think one of the questions that really comes to mind here is, you know, how did you prepare for that placement? You said that you didn't necessarily have a choice in it, and the opportunity was given to you, but how did you prepare yourself for that placement?
So I think that's a really difficult question, because as a student you never think about leadership, or as I didn't, and I think when you talk to all my colleagues, they wouldn't even think of leadership at student level. So we were in contact with Wendy and we were asking her questions, and she was like, oh, when you get here you'll go through it, and I feel like maybe more I went through like a reflective process in myself, like, is this what I want to do? Do I even know what leadership is? And I feel like from talking to my colleagues and my lecturers, they were saying how much of an amazing opportunity this is, and this, you know, will change your practice forever, and this is, you know, once in a lifetime kind of opportunity, and that I should take it. I feel like that's what I had to do. But I don't think it was until I started, and maybe in my second week, did I really understand what leadership was and why I was there and what the purpose, and how an OT or any other allied health professional could benefit in a leadership style, or leading a service that wasn't your traditional leading the service from like a band 8 in a hospital, which is something which I think many of us say, oh, we don't want to do. I don't want to do that. And that there's many more opportunities out there that are leadership that you don't realise. And leading myself as a person, it was one of them that's probably been the most influential.
I think that's a really important point to pick up on, isn't it? That we have this view of how leadership might be when we qualify, what those opportunities might be throughout our career. And so that can sometimes be a barrier to engaging in or taking up those opportunities. But it's seeing it differently, isn't it?
Yeah.
You know, and those different experiences that you can have. What sorts of, I think from that it's interesting, what sorts of discussions had there been at university, or what sort of teaching or learning opportunities had there been about leadership? Had there been much discussion around that during your learning?
So as in occupational therapy, in your third year you start your placement in September. And at that point, we had no discussion about leadership. We knew it was in our wheel of practice, but our pillars of practice, but we hadn't had any. And all I knew was that leaders are the people who tell you what to do from above. I didn't know that there was any other type of leading, whether that's, you know, managing yourself, making sure you're being your best so you can help others, or doing research that's driving practice, or supporting others. I didn't realise there was more dimensions to leadership than what I'd already knew. But what I did find is when I came back to university, and we did have a leadership module after I'd just done my leadership placement, that lots of people were struggling to get the concept of it together because they didn't have any knowledge or experience of what it would look like out there, or in different dimensions. And I feel like until you see it and experience it yourself, it's hard to change that perception and culture of leadership that's so embedded in us from even like a young age, that you listen to the one above and that's what it's like.
Yeah, and it sounds like your experience of placement has helped you to see those opportunities for more collective leadership and sharing that leadership with colleagues, doesn't it?
Yeah.
So I guess on reflection now, how would you support other people who've maybe been offered a leadership placement? What advice would you give them, or how would you help them to prepare for that placement?
So I think I would suggest them to do exactly what Wendy told us to do, is just to come with a blank sheet and just be ready to accept, because I feel if I did my research before coming in there, I would have gone in with all I would have known is the theory, and even the research out there, even the lectures I've had are still, they're not very flexible, they're not very applicable. You have to really experience it out there, and as you're experiencing the leadership opportunity, think, oh, what element of what I've learned is applying here, or if something's not going right, or what element of leadership have I learned can go here, or doing the research yourself. And I feel like getting in there and just taking up every opportunity, and I think working on yourself. As soon as you get there, just think about you're leading yourself, and then all the other items of leadership and all the theories and all the things that seem pointless at a band 5 or even a student, they start to make sense when you can actually apply them to yourself, because they become more meaningful.
I think that's a really good tip, isn't it? To think, to reflect on your own skills and where you feel you're at, and where your strengths are, and maybe those areas that you feel that you'd like to develop, and how that placement may support you to do that. I think that's really important. And so you mentioned about how your leadership placement has then been useful in your clinical practice going into work. What sorts of examples do you think have really illustrated the impact of your leadership placement?
Yeah, so out of the placement opportunities, before starting this role in a hospital, I'd only had community, and I was very worried that after having community and then a leadership, and I was going into a hospital role, that I wouldn't know those skills and I wouldn't have those skills. What my leadership placement taught me is that I can go into any role as long as I lead myself and I'm managing myself to be able to take on that role. So what I learned was my time management, self-resilience, how to look for the things I need, how do I get those, how do I apply those, how to talk to people that are outside my network, expanding my network, making sure that I'm reflecting and that I'm getting the help when I need it. And I feel like that has made me settle into the team quicker, even though I may not be fully aware when I started of all the procedures within the hospital. I was aware of how I could do what I could do myself. I was aware of my own strengths and my limitations, and I knew techniques of how to reduce those limitations and where I can get that information from. It's also made me more confident in myself. As you're aware, talking in a conference is quite a big thing, and after doing several talks in front of the heads of services, and Wendy encouraging us to feed back to the whole of HIW of our experience, it really kind of gives you those opportunities to face obstacles and overcome them. And I feel like we've all had that awkward conversation on the phone with a family member who doesn't agree with you, or a family member, or a nurse who isn't agreeing, or a consultant that's giving different information. I feel like I know how to overcome difficult obstacles and how to hold myself and remain professional. And if I'm being honest, if I don't know an answer, just being able to say to myself, okay, I don't know it, but I will be able to find it because I can manage myself and my own professional practice.
What a brilliant reflection, Lucy, of the impact of your leadership placement, and how those skills really are transferable, aren't they, as that strong foundation going into your clinical practice. Skills around communication, time management, your reflection, influencing, I think it's just wonderful to see the impact of your placement, and it's quite a different style of placement and quite innovative. I think hopefully those sorts of opportunities for our new AHP colleagues in training, I think hopefully as they increase and develop, that will show, won't it, the benefit of that different way of having placements. So that's brilliant, really exciting. Thank you for giving your reflections this morning, and I'm sure that some members of the audience will have some more questions for you, so we'll just hand over to Ross and Sue, and then if we've got any further questions for you, we'll ask. But yeah, thank you so much. Brilliant.
Thank you.
Yeah, thank you, Laura and Lucy. That was great conversation started there, and yeah, lots of questions I'm sure already. So I'd like to thank Sue for coming as well today, Sue Wilson. And firstly, Sue, I just invite you to kind of introduce yourself and tell us a bit about your career journey so far, if that's okay.
Yeah, of course. Thanks, Ross. Yeah, thank you for inviting me. So my name is Sue Wilson. I'm about to take up the consultant therapist role in Stroke, also in Swansea Bay. I qualified quite some time ago as a physiotherapist, and I took my first sort of rotational jobs up in Scotland before I did a series of sort of locum posts, and then went off travelling and worked out in New Zealand for about 18 months, where I took on my first sort of team lead post out there, really, and that would be my first experience of managing a service and the people who worked in it. After that, I came home and I did a little bit more locuming again. This time I locumed in Cardiff, totally fell in love with Wales, and I haven't left since. I took my first static job in Swansea back in 2004 in Stroke, and I've worked in Swansea since then. I've been fortunate enough as well that I was offered my first secondment for 6 months shortly after taking on that role, really to look at, I was allowed to step out of the clinical practice into the community services. I was looking at setting up a community-based falls programme, and I'd say this is probably the first time I took on a non-clinical role. And it involved working with local authorities, charities, and developing staff training and devising this community-based physio-led exercise programme. The programme was really devised by the team of physiotherapists and support staff who all worked very collaboratively and in partnership to ensure the success of the programme. And then following this, my substantive role was extended to include a community element and also a larger inpatient physio element. And that enabled me really to look at starting to represent physiotherapy at board meetings. I worked clinically, and I also managed a large and very diverse team. And looking back, it was hard work, but I absolutely loved it, and I learned a huge amount about leadership and management. I then applied for my second secondment, and this was a project-based management role. And from my career history, you can see I had very little project management experience, bar the community project. But this one was quite different. This one was spanning 2 health boards, looking at setting up an entirely new service. And to be honest, I applied for it for experience. I did not think for 1 second I stood a chance of getting it. I was successful in getting the role, and to be honest, this is probably where I learned the most about the NHS and how health boards actually work. I was working in a more corporate section of health boards, so I would be reporting to some of the executive directors, and it was a truly terrifying but incredibly educational experience, really. And since then, I've been on secondment ever since, really, mostly again in project-based management roles, working within different sections of the NHS. And as I said at the beginning, I've just been appointed as the new stroke therapy consultant in Swansea Bay, which I'm absolutely delighted, because this role enables me to do the 2 things that I love the most, and that's work clinically and work with the team to develop services. I've also been very fortunate to work to be involved in some national work, whether that's representing physiotherapy on national forums, but also during the pandemic, I was involved with Wendy actually in writing some of the documents for Welsh Government, and I've been part of the team that was producing the rehab modelling tool, for which I'm very proud of, actually, that piece of work. I suppose my message in that story really is that I'd really encourage people, like Lucy had said, to explore those different opportunities you get out with those professional boundaries, perhaps, as it really does enable you to make those links again, like Lucy was saying, and learn different things about the organisation that you work in.
Oh, thanks, Sue. That's an incredible journey and really interesting experiences. And I think you're right. A key point is stepping out of that comfort zone, or that clinical, I think you mentioned, when you first stepped out of that clinical environment and did something different. And yes, we do feel a bit nervous and a bit anxious, but that's quite common, it sounds like, isn't it? And quite normal. So that's really good to hear. And we were interested, Sue, into, did you always know you wanted to be a leader, or was there a certain point on this journey where you realised that leadership was for you, or something you want to do?
I think the simple answer to that question, Ross, is no. I didn't know. If I'm honest, it didn't even cross my mind when I first qualified, and I just wanted to be a good physiotherapist. Honestly, in fact, when I first qualified, and I'm showing my age now, that leadership wasn't a thing that was talked about. It is a relatively new concept to the NHS. When I first qualified, it was about management, and management back then was very much linked with power and authority. And I can very clearly remember my first manager and how he interacted or not with staff, and everybody was absolutely terrified of him. And I think my first experience was, I just remember thinking that I don't want to be like that. And then I suppose I slowly grew in confidence as I moved around a bit more, and I did a few more jobs, and I started realising that maybe some of the ideas that I had discussing them with colleagues could potentially be beneficial. And then I started to look for sort of opportunities or jobs that had service development opportunities built into them, really. And I think throughout my career, I've seen the leadership develop and change and really come to the forefront. And I think it's absolutely fantastic that AHPs are now creating opportunities for themselves and blazing trails for others, so that people can follow or hopefully take it even further than where we are now.
Yeah, thank you, Sue. I think you touched on something we were going to ask about that leadership journey now. Is it obvious to people there is a leadership path rather than a pathway into management? And I think, as you touched on, maybe that is clearer now for AHPs. Actually, there are opportunities, and it is being spoken about more. So that's really great to hear that. So you touched on someone you saw who maybe made you realise, oh, actually, I don't want to be like that. I don't want to be that type of manager. Are there any inspiring examples of leadership that you've seen along your way?
So to be honest, I've struggled with this question, Ross, since you guys sent it through to me, and I've thought long and hard about it and discussed it with several colleagues. And I think part of the reason I've struggled with it so much is what I alluded to in the previous question, really, about that leadership being quite a new concept. So going back to my earlier part of my career, I don't have any inspiring examples to give you, but one thing I would say is that I did learn an awful lot from everyone I've worked with, whether that be positive or perceived positive or negative, and that experience has been absolutely invaluable. And I think moving more recently, I have experienced some excellent examples of leadership, and I suppose the one I'm going to pick out is I've picked it quite carefully because I really want to illustrate the point that I think Lucy was making, was that leadership is for everyone. It's not about positions, job titles, or your salary. In my opinion, if you can inspire someone, you're a leader. So I'm going to take you back to that community-based project that we did that I mentioned earlier. That involved qualified and support staff. And the success of that project was truly down to that team, not me. That team was relatively new and very small. It worked together. It set up its own group to devise and develop these ideas. And this group was really that very safe space where anybody, regardless of their grade or job title, could come up with an idea, and that would be discussed and developed and decided upon. Within that group, they also brought in service users, which, when we were talking about that was again a newer concept, and they worked with those individuals to really continuously evaluate that service, develop it, and present the work widely to other people. And for me, I think that's a fantastic example of that collaborative leadership. that you get is really, my job was really to go and fetch and get things that they needed to do. They devised it and how it worked. And I think, throughout my career, obviously there are a number of people that have influenced me massively, way too many to mention. And I would just reiterate that that whether that was in a positive or negative way, I would like to think that I've learned and reflected on each one of those and taken that forward to try and work out what sort of leader I would like to be.
Oh, thank you, Sue. No, I think that is a great answer, because I think it is individual, isn't it? And I think what you touched upon there about the collaborative, about anyone can have that voice and have that influence on people, isn't it? Positive and negative, but obviously the positive is it usually comes out on top, especially what we've seen, the people today and the people that have helped Laura and I in our projects, a lot of enthusiastic, good leaders out there. So it kind of leads on to, in a way, so you've answered it, but why it's so important that AHPs are leaders, come forward as leaders today, really, Sue,
I think, Ross, it's about having that positive role model. I think that's so important. Listening to Lucy speak, Wendy clearly had a big impact on Lucy and how, what Lucy learned and how she's going to take things forward. And I think that is so important for people to be able to think, I want to be like that. And if they can do it, so can I. And I think that is so important. And I think, in developing those new and extended opportunities for HPs, really encouraging people, like you've said, maybe to step out, definitely to step out of your comfort zone, as terrifying as it is, do it, but also maybe look for opportunities out with your profession, like Wendy's role in HIW, like the project management roles. Don't think that because we are trained to do a particular professional job that's our skill set is so diverse and quite unique, to be honest, that we are, I believe we are quite primarily placed to do a lot of different roles. And I think once you get into those roles, it is about highlighting the skill set that the AHP workforce has, and how diverse it is, and really showing people what it is we can do. But also, as well, Ross, it's about challenging that very traditional medical nursing model that we have within a lot of our organisations, and really saying, actually, yes, okay, that was traditionally done by a doctor, yes, that was done by a nurse, but actually, why couldn't we have, somebody else from a different background to do it? And I think that is also very, very important. And it's about inspiring others. We need a workforce that can look through all the challenges that we are facing now in the NHS and see these as opportunities and development ideas, and really take things forward, because we all know that the NHS needs to change. And if we've got leaders from many, many different backgrounds, it's going to give us the best possible chance of succeeding in that. And I really don't think that there's generally a limit to what AHPs can do. I think it's really only the limit that we put on ourselves sometimes that is the barrier. And I suppose one thing just to really reiterate is that I really do think we've got that unique and very diverse skill set. We are trained to analyse, problem solve and listen. And in my opinion, these are all excellent leadership qualities.
Thank you, Sue. That's great. And I think that does really hit home. And I think, today, obviously listening to you and Lucy has been inspiring for me, and I'm sure the people listening. So it does show us what we can offer. And I think you point out those unique skills that AHPs have. I think in the role, stepping out of my clinical role as a physiotherapist, I've realised, how many amazing AHPs from different backgrounds, as you said, have what they've got to offer. So it's been brilliant for me personally to learn about it, but I think for everyone else nationally to hear about it is a great thing too. So thank you, Sue. That's all the questions from me at the moment, Sue and Lucy. But I suppose now, Laura, we can open a question and answer if there's any questions from anyone else in the audience at this point.
Yeah, I've just checked the chat. I can't see anything at the moment that people have brought in, but if anybody does want to put their hand up to come off mic to ask a question, that's absolutely fine. I guess I'd like to ask a question to both of you, really, around if there's any particular resources that you would recommend around leadership, anything that you have read or seen that you found useful in your own leadership journeys that you would recommend to other people to look at or to read.
So I wouldn't say I looked at specific books. I feel like it depends what type of learner you are, but I really enjoyed, there's loads of really good YouTube videos that lots of TED Talks on leadership that really put the application from that theory into practice, because not everyone has that opportunity for leadership, unfortunately. And I think it's hard to put those theories into practice without hearing examples or relating to a story. So I really recommend TED Talks. They have one on all the different types of leadership. Compassionate leadership is one that we really focused on, and I feel like I resonate with the most as a leader. And that didn't have as many TED Talks on, but correct me if I'm wrong, is it the King's Trust? Is that right, Wendy?
King's Fund, yeah.
King's Fund, yeah. Yeah, on Gwetla, is that still a thing?
Yes.
Great, yeah, great. They've got loads of articles on there, lots of resources, and that can really give you some examples of how it's applied to health and social care as well, because they've really made those applicable, which I think is better than reading from a textbook.
I think that's a really good point, Lucy, around, there are a range of resources out there. It's just knowing what's there, isn't there? And I think particularly knowing how busy clinicians are, and that we haven't always got lots and lots of time to read something that's really kind of in depth or too long. Things like podcasts, TED Talks, YouTube videos, those snippets of things can be really helpful to just change your thinking a little bit and get you reflecting. So I think that's a really, really good point. And actually, towards the end of the session, we've got some resources to share that do include, a variety of options for, as you said, different types of learners. So I think, really important. Were there any resources that you had reflected on at all, Sue, that you would signpost us to?
I mean, Laura, I was lucky enough to be able to do an MSc in healthcare management, and I think that was fantastic as well. But I was about to say, I did just echo what Lucy says, that there are some fantastic TED Talks on YouTube and resources online that you can look at that are excellent.
Yeah, I think there's so much more available now, isn't there, that we can easily access, and it makes sense. And I think as well, just to pick up on your point just before, Lucy, around compassionate leadership, we know that this is something that within Wales really has been adopted, and it fits as an approach with us as AHPs because we are holistic in the way that we work. We do look to share that leadership with people, as we've talked about, making those connections with partners, supporting, being an advocate for our patients to hear their voices, and the people that we work with. So compassionate leadership for people who aren't aware of that is certainly something that as AHPs we can certainly learn from, to put into practice and to develop our leadership. I'm just checking the chat. I can't see any other questions at the moment. If there was anything else that people wanted to come in with. Did you want to come in, Sue?
Yeah, can I ask Lucy a question? Lucy, what are your plans now in terms of taking on that, developing that leadership role that you've taken on?
So at the moment, as this is my first rotation, what my plan is to use those skills to keep taking these opportunities. Every time Wendy emails me saying, I've got another something for you, I'm like, okay, because I don't want to lose touch with what I've learned. Keeping it active, keeping it recent is really important. I also, opportunities that I've been given as a band 5 within my health board, I've been just trying to take those, even how small they are, whether it's my band 7's off this week and she's got a student and she says, can you keep an eye on my student this week, and I've actively tried to create opportunities for her. And even though that seems small, actually I'm able to apply my skills, and it's like learning a language, isn't it? It's when you stop using it you lose it, and I need to keep it fresh. But I would like to, after being a band 5, I would like to maybe do a bit more rotational band 6 role, because I think it's really important it was probably with all allied health professionals, get as many skills, try leading in different areas because everywhere is slightly different. And then I would like to one day work in like a service improvement role. I'd like to be Wendy really, but you know, not all is possible. But I feel like it opened my eyes. I've always liked research. Before this degree, I did a psychology degree, and I really liked the research aspects of it. And I really like what I like about the HIW service improvement kind of aspect is that you do all this research, put this effort in, and then you act on it. You make a difference, and I've seen that from the project I did with peer feedback, and that they saw a decrease in the educators having to call the university for support because the students were creating their own support networks, and that they were becoming more self-reliant and more resilient. And I kind of like seeing the effect that your actions are having. So I think that is a role I'd like to take. And I think how I plan to take that role is to keep in touch with Wendy, keep building that network, keep working with as many people as I can, and saying yes to all the opportunities that I'm given, because I feel like I'm very lucky to have been given the HIW role in the first place. And that I wouldn't be sitting here today, I wouldn't even be considering leadership today if it wasn't for Wendy providing me that opportunity. So I'm very grateful, and that it's changed my whole career path idea of what I want to do.
It sounds like you've got a really exciting career ahead of you, Lucy, and that placement really has, you know, influenced, as you say, perhaps even changed what you thought could be possible. So yeah, amazing stuff. Was there anything else from you, Ross, before we move on?
No, just a quick reflection from both Sue and Lucy's thoughts there. And I'm, I think, 15 years qualified now, and I still have those feelings, Lucy, when someone asks me, do this presentation or do you want to do this? And that really resonates with me. And I can see that maybe if this opportunity was there for me earlier in my career, it would have been a great opportunity. I would have maybe shied away from it, but I can see really good points there. So thank you. And I think that leads us, well, it's my job to try and summarise now, Laura, I think, isn't it? I've been trying to jot things down from the two speakers. But if we can move the slide forward one, Lauren, please. And, oh, sorry, it's the Mentimeter first, so I got the wrong order. So I think it's a repeat of the question. Well, another question, sorry. Do you see yourself as a leader? And it's a yes or no answer. So maybe from the information today, it might influence your answer potentially. But be interested to see what people think. And I think that really reinforces that score, that we are promoting leaders at every level. Everyone is a leader. So that's great to see. Quite a high score there. Thank you. So everyone had a chance there to put one on. Okay, can we move forward another slide, Lauren? I've just lost the... Lovely. So, yeah, I'll try and summarise as best I can now, because there's been lots of great points there. But as I just said, the importance of leaders at every level. So to improve clinical outcomes, succession planning, and your individual career path, as Sue and Lucy have touched on there. Imposter phenomenon is common. It happens to most of us at some point. You need to talk about things with people, colleagues, find strategies to challenge and overcome any negative thoughts and potential impacts on you or your career or your service. And as we mentioned there, AHPs have unique skills and knowledge, so we can lead services. And as Sue has said, we can challenge and help, you know, change these traditional models of practice that have been there. So not just change them, we can help with what's going on. We should be reflective. I think that's been said a lot. Reflect on our own skills, what we can bring to something, you know, the positives, what we can do. Step out of your comfort zone, challenge yourself, you know, say yes to opportunities. And as Lucy just touched on again, network, and keep those networks, keep talking to people. As Sue said as well, those positive role models are key, like Wendy. Wendy's been put as an example by Lucy, a great example. And again, two great examples today of Lucy and Sue. And be compassionate, not just to people, to yourself as well. So when you're looking at opportunities for yourself to develop your career as a leader, but at any stage. So really from your undergraduate all the way through your career is the message today. And we hope, and I think it's already been said, there's many more opportunities out there now, and the message is getting out there to people. So keep spreading that message. So on that, I don't know if I'll just ask you if there is anyone wants to make a comment in the chat bar, like a take-home message, or something they've taken, personally from today that they've learned. That would be great. And if not, I'll invite Laura back in just to add to that summary if you want, Laura, and just point you towards the resources we've come up with.
So if we just move on to the next slide, Lauren. So we've just put together some resources and links for you. So moving on from what both Lucy and Sue were saying about the variety of options that we've got now to look at leadership. We've put together some resources from the King's Fund. There's some really good self-help resources out there, short workbooks, flyers and leaflets as well. There's some brilliant podcasts. I would recommend the Leadership Log as a really accessible podcast, really interesting. Leaders from across the health and social care system that can just give that different perspective on things with some really practical take-home points around things like resilience and developing your skills. And then in terms of TED Talks, from previous masterclasses that Ross and I have attended, we've had recommendations for particularly the one around fighting imposter syndrome, and the TED Charlotte talk as well at the bottom is a brilliant talk to support with reflecting on if you've experienced symptoms of imposter phenomenon and how to help. And there's a second slide if we just move on. So some references for you there around the theory if you're interested in digging a bit deeper into that around imposter phenomenon, and links also to the quiz that we talked about before to help with identifying those symptoms that you may have of imposter phenomenon, and then again some more practical tips to manage. So I think that brings us to the end of our session today, just in time. So please do keep the conversation going after the session today. Feel free to share and to tweet about the session, but also to get in touch with any of us at HEIW for more information around leadership, and to keep talking about it because it's really important. Thanks so much, everyone, and thank you so much to our speakers for taking the time to come and talk with us today. It's been brilliant to have those conversations. Thank you.
Yeah, thank you for having me.